right? And so this is, again, where I think the God is in the details, what we hear about and talk about. I mean, if I could make like an editorial comment here, because I am affected by the same thing. We live in this incredible age where we can listen to podcasts like this one and many others. We can flip on a television and scroll through a million different options. We are able to use social media and get a lot of information all the time. How do you sort through all that information? And how do you know what's misinformation? How do you know what's urban legend? I mean, I just told you that 10,000 Steps is an ad jingle from the 1960s that is still being bandied around. All right. And a lot of people believe those. All right. I think the key thing is try not to, I think, again, this is a little bit of that self-reliance. Whatever you hear, if it's interesting, to have a healthy amount of skepticism, check it out yourself, talk to other people. And a lot of things, especially in a health and wellness community that get talked about, might not be ready for prime time, might be a great idea, but not for you. It might be an urban legend. Don't eat soy because it's going to cause breast cancer. Tomatoes have lectins. You and I have talked about this before on your show. There's so many of these things out there. I kind of feel like my responsibility, and I know you've done an amazing job about this, is to have really level set conversations about what we know and what we don't know. And wherever possible, bash a myth whenever you can. I think that's what's helpful for people, especially when you talk about these aspirational areas like longevity.
Welcome, everyone, to a vital discussion about navigating the complex and often confusing landscape of health information in our modern world. Today, we have the distinct privilege of gaining clarity from Dr. William Li, a physician and scientist who is not only dedicated to understanding the intricacies of human health, but also to empowering us to become discerning consumers of health information. In an era where a wealth of knowledge, and indeed misinformation, is readily available at our fingertips, Dr. Li offers crucial guidance on how to cultivate a healthy skepticism, foster self-reliance in our health journey, and effectively fact-check the claims that come our way. Prepare to equip yourselves with the critical thinking skills necessary to navigate this information jungle and make informed decisions about your well-being. Think for a moment about the sheer volume of health-related content we encounter every single day. From news articles and social media posts to podcasts and well-intentioned advice from friends and family, the information is endless and often contradictory. Sorting through this vast sea of data to discern what is accurate, evidence-based, and truly applicable to our individual needs can feel like an overwhelming task. Dr. Li recognizes this challenge and emphasizes the importance of developing a discerning approach to the health information we consume. He points out that while the internet has democratized access to health knowledge, it has also created an environment where misinformation and unsubstantiated claims can spread rapidly and widely. Many widely circulated health claims, often presented with great conviction, may in fact be based on flawed studies, anecdotal evidence, or even outright fabrication. These claims can range from miracle cures for chronic diseases to simplistic solutions for complex health issues, and they can often prey on our hopes and fears. Dr. Li stresses the importance of cultivating a healthy amount of skepticism when encountering new or sensational health information. This doesn't mean dismissing everything we hear, but rather approaching new claims with a critical eye and asking pertinent questions. What is the source of this information? Is it based on rigorous scientific research? Are there any potential biases or conflicts of interest? Is the information being presented with hyperbole or emotional appeals? These are the types of questions that can help us to evaluate the credibility of health claims. Furthermore, Dr. Li encourages us to foster a degree of self-reliance in our health journey. While seeking guidance from qualified healthcare professionals is essential, we can also empower ourselves by learning about our own bodies, understanding our individual health needs, and becoming active participants in our care. This involves being curious, asking questions of our doctors, and taking the time to research health topics from reputable sources. Self-reliance in this context is about being an informed and engaged partner in our own well-being, rather than passively accepting every piece of information that comes our way. Crucially, Dr. Lee emphasizes the importance of fact-checking health information. In today's digital age, it is easier than ever to verify claims by cross-referencing information from multiple credible sources. Reputable medical organizations, government health agencies, and peer-reviewed scientific journals are valuable resources for accurate and evidence-based health information. Dr. Lee encourages us to be wary of information presented solely on personal blogs or social media without clear scientific backing. Taking the time to verify claims before accepting them as truth is a vital skill in navigating the modern health information landscape. He also cautions against the tendency to believe that a single health solution or approach is universally applicable to everyone. What works well for one person may not be suitable or effective for another due to individual differences in genetics, lifestyle, and underlying health conditions. Many widely circulated health claims may be based on studies conducted on specific populations or under specific circumstances, and their applicability to the general public may be limited. Dr. Lee encourages us to consider our own unique circumstances and to consult with healthcare professionals to determine what is truly appropriate for our individual needs. Dr. Lee often shares anecdotes of patients who have been misled by unsubstantiated health claims found online, sometimes delaying or foregoing evidence-based treatments in favor of unproven remedies. These stories underscore the potential harm that misinformation can cause and highlight the importance of developing strong critical thinking skills when it comes to our health. He emphasizes that while hope and optimism are important, they should be grounded in accurate information and informed decision-making. Now, before we delve deeper into practical strategies for evaluating health information and cultivating a discerning approach, we want to build a supportive community around this vital topic. If you are finding Dr. Lee's insights on navigating health information and misinformation valuable and are committed to becoming a more informed consumer of health knowledge, please take a moment to like this video. Share it with your friends and family who you believe could also benefit from these critical thinking skills. Subscribe to our channel for more empowering content on health and well-being. And most importantly, we invite you to share your own thoughts and experiences in the comments below. What are some of the challenges you have faced in sorting through health information? What are some of the strategies you use to evaluate the credibility of health claims? Your stories and insights can inspire others and help us build a collective understanding of how to navigate the health information landscape effectively. Let's learn and grow together. Developing a discerning approach to health information involves cultivating a set of critical thinking skills and adopting practical strategies for evaluation. Dr. Lee emphasizes that this is an ongoing process, a continuous effort to refine our ability to distinguish credible information from misinformation and to make informed decisions about our health based on the best available evidence. One of the first steps, Dr. Lee suggests, is to always consider the source of the information. Is it a reputable medical organization, a government health agency, a university research institution, or a peer-reviewed scientific journal? These sources typically adhere to rigorous standards of evidence and transparency. Be wary of information from personal blogs, social media influencers, or websites with obvious biases or commercial interests, especially if they make sensational claims or lack clear citations to scientific research. Dr. Lee also advises us to look for evidence-based claims. Credible health information should be supported by scientific research, ideally multiple, well-designed studies. Be skeptical of claims based solely on anecdotal evidence, personal stories, or opinions without scientific backing. Look for citations to research studies and be willing to investigate those sources if possible. Remember that correlation does not equal causation. Just because two things happen together doesn't mean one caused the other. Another important strategy is to be wary of exaggerated or sensational language. Claims that promise miracle cures, instant results, or use emotionally charged language should be approached with caution. Legitimate health information is typically presented in a more balanced and nuanced way, acknowledging the complexities of health and the variability of individual responses. If a claim sounds too good to be true, it likely is. Dr. Lee encourages us to consider the potential biases of the information provider. Are they trying to sell a product or service? Do they have a particular ideological stance? Understanding the potential motivations behind the information can help us to evaluate its objectivity. Look for sources that disclose any potential conflicts of interest. Cross-referencing information from multiple credible sources is also a crucial step in fact-checking. If you encounter a health claim that seems interesting or significant, take the time to see if it is supported by other reputable organizations and research findings. If the claim is only found on a few obscure websites or social media posts, it is more likely to be unreliable. Dr. Lee also emphasizes the importance of consulting with qualified healthcare professionals. Your doctor, pharmacist, or other healthcare providers are valuable resources for personalized and evidence-based health advice. They can help you to interpret health information in the context of your own individual health history and needs. Do not hesitate to ask them questions about health claims you encounter. Furthermore, Dr. Lee encourages us to be aware of the logical fallacies that can often be used to promote misinformation. These include appeals to authority, citing an unqualified person as an expert, appeals to emotion using fear or hope to persuade, and false cause assuming a link between unrelated events. Recognizing these fallacies can help us to identify and resist misleading claims. Finally, Dr. Lee stresses that critical thinking about health information is an ongoing skill that we can continue to develop over time. By being curious, asking questions, seeking out credible sources, and engaging in healthy skepticism, we can become more informed and empowered consumers of health knowledge, better equipped to make sound decisions about our well-being. In conclusion, Dr. Lee reminds us that navigating the vast landscape of health information in our modern world requires a thoughtful and discerning approach. By cultivating a healthy skepticism, fostering self-reliance in our health journey, and diligently fact-checking the claims we encounter, we can empower ourselves to make informed decisions based on the best available evidence. It's about becoming critical thinkers and active participants in our own well-being. He encourages us to choose one practical strategy for evaluating health information that we can implement today. Perhaps it's taking a moment to check the source of the next health claim we encounter online, or deciding to cross-reference new information with a reputable health organization's website. Every step we take towards becoming a more informed consumer of health knowledge is an investment in our long-term well-being. Now, as we conclude this vital discussion on navigating health information and misinformation, we want to invite you to become an active part of a supportive community dedicated to promoting informed health choices. If you have found Dr. Lee's insights valuable and are motivated to become a more discerning consumer of health information, please take a moment to like this video. Share it with your friends and family who you believe could also benefit from these critical thinking skills. Subscribe to our channel for more empowering content on health and well-being. And most importantly, please share your own experiences and tips in the comments below. What are some of the challenges you have faced in navigating health information? What are some of the strategies you find most helpful in evaluating health claims? Your stories and wisdom can provide invaluable support and encouragement to to others seeking to make informed decisions about their health. Let's connect, share, and empower each other to navigate the health information landscape effectively. Thank you for joining us.